All right. So there has been a surge lately in research that I've been super excited about, getting pregnant and postpartum women more information about being active during that time and in postpartum. And we've got one of the researchers involved in that, Dr. Rita Deering. Thank you so much for being on the show this morning.
Yeah, thank you for having me.
So how did you get into this? And one of the things what I was learning a little bit more about you is so much of your research is on trunk flexors. Like,
Yeah.
who wakes up in the morning and says, "This is what I want to study"?
Yeah. So, I actually kind of fell into it in that I was working in an outpatient orthopedic clinic, and we got this like frantic page that our healthcare organization had an exercise class for pregnant women, and the instructor backed out last minute. So they're like, "We need somebody to teach this class, like, please, otherwise we're gonna have to cancel it." So I was like, "Yeah, okay, yeah, I can do that."
Yeah.
Um, And so one of the things that we did as part of that class is we assessed interecti distance just with finger widths and just gave some education on like body mechanics and things like that. But every session of that course that I taught, I ended up teaching that class for several years. But every session that I taught, there would be at least one person who would completely freak out when we started talking about the abdominal muscles
Yes.
separating. And so I would get all of these questions like, well, what does that do? What does it do to the strength of my muscles after my baby is born and all of this stuff? And at that time, I wasn't in women's health really. So I was like, I'm not sure, but I'll find out for you. So
Yeah.
I went home, I did a lit search, and I was like, holy cats, how do we not have any research on this?
Ah.
And so then I started taking some women's health courses, trying to
Yeah.
see if maybe there was something that I was just missing. And it turned out there wasn't.
Nope.
so, um, so about 2 years after I started teaching that class, I went back for my PhD and decided I was going to study this. Um, and so trunk flexors is just because, when you're studying this in vivo, we can't isolate a single
Right.
muscle, right? Um, so to keep reviewers happy, you have to be a little
Right.
bit more general than just
So
saying
we're gonna do
the
some
abdominal muscles.
translation here, right?
Yeah,
Exactly. But I
yeah,
had to crack up because I knew that you were, it was generally that's what you were looking at, but it
yeah.
cracked me up to see it so formally as trunk flexors. Like,
Yes, yes.
I love
Yeah,
that.
language is very important, so it's like, I don't know if you can use that word, so yeah,
I love it. But
yeah,
you really, I mean, how many times have I talked to clinicians that are like, "Oh, I wish there was more research." You actually said, "I'm going to go do the thing. I'm
mhm,
going to find this out." Like, that's not a small decision. Like,
yeah,
what
yeah,
inspired you to be like, "Honey, guess what? We're gonna do PhD." And
yeah. So, I had always kind of kicked around the idea of going back at some point,
yeah,
and even, when I left my PT program, they were kinda toying with the idea of starting a PhD program, so they had done, like, a survey of, like, "Hey, if we had this program, would you be interested in it?" And I said,
yeah,
"Yeah." And so I worked full time for 5 years before I went back. So, I kind of always knew that it was something that I was always interested in research. Um, I just didn't have, like, a burning question until I started teaching that class where I was just like, "It
gotcha.
is shocking how little information there is." I mean, it's a very, like, clearly visible, like, you see the abdomen expanding. Like, how do we not investigate this?
Yeah, I
So
won't I won't say why patriarchy, but anyway, like
Right. Yeah, so that was my burning question where I was like, "Okay, it's time. Let's do it."
good for you. So
Yeah.
that brings us to one of the most recent studies that just came out in JWHPT was kind of looking at that four-phase approach as far as return to run. And you are just one of the co-authors
Mhm.
on this study. And so I just kind of give us the 90-second lowdown, and then kind of what were you guys hoping to accomplish with kind of putting this out here, and then what's the feedback that you've gotten?
Yeah, so our main goal was, well, first of all, I mean, as you know, with social media, you can run the gamut on recommendations, right? Like, there's recommendations like I literally saw something on social media where the person the day after giving birth was out running. And
Yeah,
then you have, like, the other end of the extreme where they're like, "No, don't even start within the first
right.
year." And so what we were trying to, and then there's a lot of comments also saying like, okay, so we have some recommendations maybe on like what to screen for, or what to look at when you're considering timing of return, but there was nothing really guiding how you do that
Yeah.
return. Um, and so we used a phased approach to try to move away from setting like a blanket time limit, right? Because every athlete's different, and every pregnancy is different, even
Yes.
within the same athlete. And so, if this is your second or third baby, and after first you were back running at 6 weeks, no problem, but now after 2 or 3, it takes you a little longer. Like we wanted to just let runners know that's okay. It's not a everybody should be ready at 6 weeks, or everybody should be ready at 12 weeks, or nobody should be ready until 12 weeks. It's really what your body is capable of at that point in time, and what your goals are. So if you're
Right.
just going out for a light jog and that's good for you, well, then you might be ready to do that faster than, say, like, we were just talking about the woman who just won Kona. So
Yeah.
it's not as cut and dry as,
Not at all.
it's not like a surgical protocol where at this many weeks we know the graft is healing or whatever. It's not that clean. And it's much more individualized. And so that's what we were hoping to get across with this phasing is, let's take the weeks postpartum out of it completely and just
Yeah.
say, based on these symptoms, or these measures of function, where do you fall,
Mhm.
and how do you progress from there, and when is it appropriate to regress, because that may be part of your training too. If you
Yeah.
think you're ready and symptoms get worse, well, then it's okay to slide
Exactly.
back into the previous phase. And so that was our hope with that. And then we used, unfortunately there isn't research yet validating any of these return to run protocols
Right.
in postpartum runners.
Right.
And so what we tried to do was use similar research, right? So we graded our exercise progressions based on EMG research. So we know the exercise in phase 3 is more difficult than the exercise in phase 2 based on these EMG studies.
Mhm.
Um, so that at least there's some sort of stepping stone, right? Like
Yep.
it's not at all a comprehensive protocol or framework we were encouraged to use, because again, words matter.
Yes,
Um,
it does.
um, but and by no means are we saying that this you can just print this off and hand this to every runner that you work with
Right.
and it's going to work for them. Like there is some some wiggle room, if you will, to individualize that for the
Yeah.
runner that you're working with.
Yeah, I appreciated that it was I do think it was incredibly comprehensive, from
Thank you.
literally do a gait evaluation, do the
Yeah.
strength evaluation. Like for me, it was like really comprehensive. But you got to get all those pieces out there so then you can
Yes.
start to have the discussion to work from. So that's what I appreciated about it, is that it was a stepping stone, like you said,
Yep.
beyond that initial screening. Like we've got to have something to work off
Yes.
of. And you guys you took it for the team and said, hey, we're gonna put it out there in all its glory and then have
Yes.
at it. So
Yeah, it was certainly a labor of love. And
yes.
and I did get some comments too of like, this is great, but do you really think that people are going to want to do like a 20-week run progression? And I said, like, that's a very conservative
Mhm.
progression that we laid out there.
Right.
If you think your runner is able to progress faster than that, great. But again, we wanted to lay out like, okay, really low level person, how do we progress them,
Right.
and progress them safely? But yeah, there's a lot of opportunity for individual runners or individual clinicians to tailor that to their specific client.
Yeah, and that's where I do think clinical expertise and critical thinking still come in,
Yes.
and we're not talking evidence-based recipe or protocol, because words
Right.
matter. We're
Yep.
talking an evidence-informed approach, and I think
Yeah.
that's incredibly important to understand if you're newer to this space or newer to working with runners, that this is not a checklist that
Right.
you're expecting to hand to somebody and say, "Do all of these things."
Correct.
You're saying, hey, best evidence to this point. Here's some things, make sure you don't miss these considerations,
Right.
but take what's appropriate for that person in front of you, which again goes back to critical thinking, problem solving, kind of expert practice sorts of
Yeah.
things. So,
And
yeah.
maybe it would bring up something that you wouldn't normally think of on your own.
Right.
You know, like I actually had
Yep.
a colleague who is a fabulous pelvic health therapist who was working with a runner and said, you know, we've got her pelvic floor strength really good. She can pass those screening things
Mhm.
like the,
Yeah.
hopping, bounding, all that. But with running and only running, she's still leaking. She's like, "What else do I do?" And I said, "Well, have you
Yeah.
have you watched her run?" And she
Yeah.
said, "No, I haven't." I was like, "Well, I would try that." You know? So
That
it's just
yeah.
sometimes like you get so bogged down in like what you typically look at that there might be something over here that you're not thinking of. And that's kind of
Yeah.
what we were hoping for with that
Yeah.
with that paper as well is maybe it'll just bring to light some other things that maybe you haven't considered about assessment or treatment that you could kind of bring into your everyday
Yeah,
practice.
I was talking, I did a interview last night with Alison Grimaldi. She's a hip researcher in Australia and just amazing clinician and just she's great at educating. And she had this blog post about a month or so ago about the hip and the pelvic floor. And so we
Mhm.
had this conversation about if you are a sports orthopedic therapist, what your kind of thoughts are dealing with the pelvic floor. And usually it's kind of the trash can. Oh, well, I can't figure this out. It must be the pelvic floor. Or if you're a pelvic floor provider and you've got an issue that if it's not pelvic floor, do you think to look at the hip, or the only
Sure.
thing you think to do is a clamshell exercise? We had a whole conversation about that. And so and I guess I kind of forget because I grew up in both worlds and
Sure.
realized there was a mashup. It's so important also too when you say, okay, have you looked at how she runs, to understand that our running assessment has evolved from maybe
Oh
15
yeah.
years ago when you went to PT school.
Yep. For
And how
sure.
there's great data to say, hey, you know what, getting in the weeds on some of this stuff may not actually be a good idea.
Yeah. Yeah.
Yeah, so I think that's I'm glad that this will kind of spawn some of those conversations of like, okay, where do we need to educate pelvic health providers, especially since so many more are going straight into pelvic health?
Yeah.
Because I mean, it doesn't sound like you or I, that's not where we started off.
Nope. Nope.
So when you have that other background, I think it's a lot easier to see, okay, this is how we find this balance. But if you do come in that one lane, I think it is a challenge. So it's great that it's kind of opening people's eyes to, oh yeah, we might need to do this a little bit more. So
Yeah. Yeah, and I know my students who come up and tell me like, "Oh, I'm interested in pelvic health. Do you have
yeah.
any advice?" And I always say, "Yeah, pay really close attention in ortho.
Yes. Oh my
You're gonna
gosh.
need it."
Oh my gosh. I was talking to Sarah Tanza. I don't know if you know her.
Mhm.
She's Pelvic Potential on Instagram. She's over in
Okay.
California. And we were talking about her story, and she came up through neuro
Okay.
and shifted over. And it was funny, we came to a lot of the same kind of thought processes about things. I think it's when you come and look through pelvic health through another lens instead of
Mhm.
just straight through, that you get some of those unique insights. And so I
Yeah.
love the mashup. I love kind of throwing in
Yeah.
whatever. But so for you, like, what are the biggest gaps? You started to, kind of dive into this a little bit more. What are the biggest gaps that you're seeing in sport, and what's kind of inspiring you to what questions that you want to look at in the future?
Yeah, so unfortunately, given the way that particularly in the US our healthcare model is, we don't have a lot of evidence on, well, what happens if we do rehab these
Right.
people? Um, and so we do have, I mean, obviously we have Olympians and, some of these elite athletes who have shown that it is possible to go back to high level sport after having a baby and to be quite successful
Yeah.
at your sport after having a baby. Um, but again, those people typically have access to personal trainers and athletic trainers, maybe physical therapists depending on their sport. And so what we need to know is, what does this look like for the general public
Hmm.
who maybe doesn't have those resources, And how do we better get information out to, just
Yeah.
any female who's having a baby?
Yep.
We have a lot of epidemiological data that shows that exercise is important, from a physical health standpoint, from a mental health standpoint, but we don't have the evidence of how we safely get them back to that exercise that
Right.
is so safe for, or so beneficial for their physical and emotional health, mental health. So, and again, there is this um, debate about timing,
Yep.
and so we need more research on that. So I'm actually working on a study right now, on return to exercise, after childbirth, looking at multiple different time points and things of that nature. So hopefully at some point we'll have
Yeah.
more data, but it's hard. It's hard to get that data, especially when it's not part of standard medical
Right.
care where we can just pull charts.
Right.
Um, Yeah, I think that's probably our biggest gap is how do we safely do it, and how do we improve not only knowledge but also access for everyone, not
Yep.
just those elite athletes who have the funds to do it and some resources to do it. And
Yeah.
even so, they're saying that they don't have a lot of great support either.
That's
Um,
what I'm hearing too. I mean, I was just
yeah,
listening, Brianna Battles just did a podcast with Annie Thorisdottir, who's, I forget how many times she's won the CrossFit Games, and she came back and got 3rd after she had her daughter Freya, and within a year, and her story of, I didn't know what the heck was going on. I was doing the best I
right,
can, and again, navigating it through COVID. Again, more of these stories that are coming out of, okay, I'm at this elite level. This is my actual day job.
right,
There's no guidance.
right.
And
Yep,
so I feel like it's almost a worse scenario than the average person because their paycheck is on the
right,
line,
for sure.
their reputation, sponsorship dollars, all that kind of stuff. And so that's where
Yep,
I think it gets really sticky too, because,
yep,
even from a research perspective, like to get clearance to perform above a certain level in pregnancy, can
yep.
you do that in some countries? Like, I don't know.
Right. Yeah. Yeah, and it's and Margie Davenport's group just put out
Yep.
a paper about that too, and again, the responses kind of ran the gamut where some people
Yeah.
were saying like, "No, I actually felt better after I had a
Right.
baby. I felt like I could perform better." And some of them were saying like, "I was really scared," because you hear all
Right.
these other stories. Um, but I think where they might have an advantage over just, a regular citizen who wants to get back
Yeah.
to running is that they have that experience with training, right? They've had like a
Yeah.
regimented training schedule.
Yep.
So they know what that looks like. They know how to modify training. And typically, again, not
Yeah.
maybe not everybody, but typically they're a lot more in tune with their body and
Mhm.
know this doesn't feel right, or yeah, I'm doing okay, to know when to tweak those things.
Yeah.
And then again, oftentimes they do have the financial resources to seek out an expert, right?
Yeah.
Like, and Celeste Goodson has posted some
Yep.
interviews that she's had with elite athletes that she's worked with. Whereas, like my neighbor who wants to go back to running can't do that,
Right.
you know?
Yeah.
And it doesn't mean that returning to exercise and to running is less important for her physical and mental health
Right.
than it is for this elite athletes.
Yep.
And so access is a huge issue
Mhm.
for across the spectrum, for our everyday, recreational athletes and for our elite athletes. Um, and so I think just trying to build some of those bridges and have this multidisciplinary approach, I
Yeah.
think would help a lot. I feel like right now there's a heck of a lot put on the birth provider's plate, right? So like your OB or your midwife is the one who has to make like literally every decision about like, okay,
Yeah.
well, can I go back to exercise? And that's not necessarily their expertise in assessing what type of exercise they want to do. And if They're
Right.
okay for that. And so I think that's a perfect place where we as PTs can come in and help,
Yep.
take that
Yeah.
off of their plate. you
That
know?
that's a conversation I have a lot with clients is, they go to that, 2 or 6 week, visit after birth and or even just that first, pregnancy visit,
Mhm.
and they ask the question about exercise, and to your point, that's not their wheelhouse. I mean, I
No.
I think from a health of the baby, vitals sort of thing, I think, yes, absolutely, but from a what exercises are safe or unsafe,
Right.
that's our wheelhouse all
Yep.
day long.
Yep.
And I don't think it's a fair expectation to have. And that's the conversation I have
Right.
with clients. I'm like, you're expecting them to know how to deliver your baby and then give you a individually programmed exercise
Right.
plan.
Yeah.
No, but if
Right.
you ask me for that, I can give you that, but I won't deliver your baby,
Right.
so
Right.
how I think when we understand and what that provider can actually provide us, then I don't think we get so upset because
Right.
they weren't skilled. They were never gonna have that skill set for you anyway. Oh,
Right.
my air conditioner turned on. I have no idea why. Hang on one second.
Yeah, no worries.
We had rain here for 6 days from Ian. We didn't actually,
Oh,
but
geez.
it was like 50 degrees, which for here
Oh,
it's supposed to be 77, and now it's sunshine. We're happy. So,
nice. Good.
but
Yeah,
no,
well,
I
and to
think
that point
having
too,
yeah,
Margie Davenport's group, they developed that Get Active questionnaire for
yep,
pregnancy. And so they just had a paper come out, I believe in July, that talked about the development of that and,
mhm,
some of the conversations that they had with
yes,
stakeholders. And there was, I believe, a midwife who did say, like, I don't always know what to tell them when they ask me if, so
yeah,
basically, like, they're getting patients referred to them to say, "Is it okay if I exercise?" And they're like, "Uh, maybe,
right,
I'm not really sure." And so, like, they were actually thankful for this questionnaire that kinda
yeah,
takes that away from them.
yes.
And I think we can do the same thing in the postpartum period as
Yeah,
well.
and I think the other thing too for us in the PT profession in the physio world, we also have to take a look at how we provide services
Mhm.
and make sure that there's more accessibility. I mean,
Yes.
there's two things I'm thankful for COVID for. One is telehealth
Yep.
acceptance, and two is delivery alcohol. But um, I'm like, I don't have to go anywhere anymore. No, it's one of those things that even just online education, or I'm
Yes.
sorry, online education, online workout programs,
Mhm.
people didn't think about that.
Yeah.
It wasn't, I wouldn't go to a trainer if they didn't, work in my neighborhood. Whereas now there's no limit.
Right.
There's no limit. Lisa Ryan, who I'm sure you know, she's a trainer in Michigan, and, I had a client, maybe it was like the first couple weeks after shutdown, I got her connected with, a client of mine, and, who she was working with here locally was like a 20-something dude that was like, "Oh, you're overweight and you have back pain, you can't do anything." And 3 months later, Lisa Ryan has this person, doing crazy deadlifts and all sorts of stuff and symptom free, and I'm like, you are not limited by geography anymore,
Right.
and the cost isn't necessarily what it would be for in
Yes.
person,
Yep.
and just the onset of, just exercise programs that you can just download and do them, and I feel like that's been such a blessing for accessibility. Like
Mhm.
if you have as long as you have, decent internet,
Right.
you've got access. So
Yeah.
I'm hoping that our profession becomes more comfortable with, providing PT in a different way, that we're not so married to our hands, so to
Yeah.
speak. So, but we'll see how that goes. Maybe you can do research on that later.
Yeah, maybe.
Telehealth postpartum care, how does that look like?
Yeah.
So you did give me a link here, and we'll post this in the
Yes.
notes. I know it's a long
Thank you.
URL, but we'll have that for you guys. Tell me a little bit about this study that you guys are recruiting for right now.
Yeah, so this is a survey study where we're looking at experiences of musculoskeletal pain during pregnancy, how those instances of pain were addressed by your healthcare providers. Were you referred to PT? Were you given other advice for pain? Were you just told, hey, when the baby's born, it'll go away? Um, And then did how was the way that your pain was managed influential in how you viewed your care, the quality of your health
Mm.
care? And there are a few other questions in there too about like delivery method, positioning and all of that stuff. But the main takeaway here is we want to see, is musculoskeletal pain being addressed during pregnancy, and whether or not it's being addressed, does it influence how our patients perceive the quality of their healthcare?
Oh, that's a good one. I have women I see all the time postpartum, and then they'll
Mhm.
mention that they had symphysis pubis pain
Yeah.
or things like that in pregnancy, and their provider just said, "Oh, well, that's just what happens," or they just give them a
Yeah.
generic belt that doesn't fit or cuts up underneath the belly and says, "Oh, good luck."
Yeah.
Um, having had SPD with both my pregnancies, it was not fun.
No, I
It's not
know. And
fun.
actually what kind of inspired this study is I had a patient that I saw her at, I think, 32 or 33 weeks, and I mean, she could barely walk
Yeah.
from the waiting room to the treatment room. And this was her second pregnancy. She had a 2-year-old at home.
Oh.
And she said, I told them starting at like 12 weeks that I had this pain, and they didn't refer her until 32 weeks. And it just
Oh.
broke my heart. And so some of the conversations that, I've heard that colleagues have had with some birth providers is like, well, I mean, because they talk about like automatic referrals or things like that,
Mhm.
and the feedback that sometimes they get is, well, is this even something that our patients want? And so this is an opportunity for women to give their input and
Yeah.
say if that is something that they want, so that we can put that out there and say, yes, they want this.
Yeah.
Please send their referrals as soon as possible.
Oh
Don't,
my gosh,
don't
yes.
wait until 32 weeks when they can barely
No.
walk.
Can you imagine with a two-year-old? Like
No, and that yeah, she was having a lot of trouble, picking her kiddo up,
mhm.
and yeah, it was genuinely heartbreaking, and I mean, and she was a warrior. I mean, she battled through it, but you shouldn't
She
have
shouldn't have
to.
to. She shouldn't
No.
have to. No. Oh, well, this will be great. I'm glad,
Yeah.
and hopefully we can get you guys some more people there, and I'll post on my social so
Awesome,
that
thank
you
you.
can do that. But if you want to find out a little bit more about Rita and the work that she's doing, she's Rita Deering PhD over on Instagram,
Okay.
and hopefully keep those studies turning out. We so
Yep,
appreciate the work that you're doing and asking
thank
these
you.
questions because it is about dang time.
Yeah, right? For real.
Yeah. So thanks so much, Rita, for being on the
Yeah,
show,
thank
and
you.
look forward to all the stuff that's coming in the research in the future. Thanks again.
Yep, you thank you.